Hi Megan, my name is Martha. I'm a nurse practitioner student. I'll be doing your physical examination today. Can you tell me your name? You can make up one if you want.
Okay. Megan Moffat,
Your date of birth?
1/24/82.
Okay. Can you tell me who is the President of the United States at this time?
Joe Biden.
Okay. So right now I'm doing a general survey, checking how alert and oriented she is, how lucid she is. Eye contact is continuous, so we'll continue with the assessment. I'm going to feel your head and your body, and we'll start off with the head. It's normocephalic, no trauma. I'm visualizing the head and the neck. The trachea looks midline. I don't see any enlarged lymph nodes, so right now I'm going to palpate her thyroid gland. Can you swallow? Okay, it feels small and smooth. Now I'm going to palpate her lymph nodes. We'll start with the preocular, post-auricular, occipital, submental, submandibular, superficial deep anterior, posterior cervical, and supraclavicular. Feels all right. I did not feel any lymph nodes. Now I'm going to listen to your carotid arteries. Look to the right. Hold your breath. Look to the left. Hold your breath. Okay. Now I'm going to look at her eyes. They're symmetrical. The sclera is white, conjunctiva white, no drainage. Now I'm going to check her peripheral vision. I have two markers here. You tell me when they come into your periphery.
Okay.
Good. Now I'm going to check her pupils. Just pick a house and stare at it. Okay. Now keep an eye on my tool here. Just follow it. Okay, her pupils are equal, round, reactive to light and accommodation. Now I'm going to look for her red reflex. I'm going to put this light in your eyeball. Okay. Usually it's under dim lighting, but this will be sufficient. Okay. So I see a red reflex. That's where the light illuminates the retina. Now I'm going to look for the optic disc. There it is. Okay. The optic disc is where the optic nerve and the retina converge. I saw that the disc was sharp, yellow, and that there were blood vessels extending out away from it. Do the same with the right eye. Here's the red reflex. Okay, the optic disc is present. The edges are sharp and the blood vessels extend outwardly. Now I'm going to look at her ears. I'm looking for symmetry. The auricles are soft, no tenderness, the tragus and the earlobe. I don't see any drainage or swelling. Now I'm going to take a peek inside. This is clean, this is new. Okay, so tilt your head to the right. Okay, I see your tympanic membrane. It's pearly gray white, translucent. I see the red reflex, the umbro, and the malleus. Let's look at the other ear. Same thing, tympanic membrane intact, gray pearly, pearly gray and translucent, minimal cerumen, no perforations. Now, let's see. I'm going to look at your nose. It looks in line and intact. Now we're going to check for nasal patency. I want you to occlude one of your nut nares and breathe in with the other one. Next. Okay, good. Now I'm going to assess her sinuses. Any discomfort or tenderness?
No.
Okay. Now we're going to take a look in her mouth. Just open up. Okay. No lesions, no tremors. Teeth intact. Go ah.
Ah.
Uvula is midline, and soft palate raises symmetrically. Thank you. Okay. Now we're going to check the cranial nerves. There's 12 of them. We're going to start with the olfactory, that's cranial nerve 1. That's descent. Can you smell this?
Mm-hmm.
What's it smell like?
Rubbing alcohol.
Okay. Next we'll do the optic nerve. I have a Snellen chart here. Please read the line, the smallest line you can see. Cover one eye.
LTOPJ.
Okay. Next one.
LTOPJ.
Okay, that's cranial nerve 2. Now we'll do the ocular motor, trochlear, and abducens. That's 3, 4, and 6. Follow my marker. Okay, so that checks the 6 fields of gaze, which were intact. The 5th cranial nerve is the trigeminal, so I want you to close your jaw. Try to open it. Close it. All right, it's intact. Also, the trigeminal is a sensory cranial nerve. I want you to close your eyes. And I'm going to touch your face with an object. You tell me if it's a hard or a soft object.
Soft. Soft. Hard.
Good. Okay. We did the 6th. The 7th is the facial. You can open your eyes. All right, make a big smile. Look surprised. Frown. Close your eyes and really squint. Okay, now puff your cheeks out. Good. That's cranial nerve 7. 8 is the acoustic. It's also for balance. And we're going to test your hearing. So close up that ear with one hand. And I'm going to whisper something in your left ear, and you tell me what I said.
Restored to sanity.
Okay, now we'll do your right ear.
Joy isn't free.
Good. Yep. All right. Acoustic. The 9th cranial nerve is the glossal pharyngeal. So go ahead and open your mouth and say ah.
Ah.
Okay. To test that one, I would use my tongue blade and gag her, get that reflex, but I'm not going to do that.
Thank you.
Okay. The 10th cranial nerve is the vagus nerve. She is swallowing okay. She's not drooling. It's intact. The 11th is the spinal accessory nerve. I want you to shrug your shoulders. Okay. Turn to the, tilt your head to the left. Right? Okay, that's intact. And the 12th one is the hypoglossal. Megan, stick out your tongue and turn it to the right and the left. Okay, great. Okay, so right now I was looking at her skin. I see she has a macula right there. That's a freckle. So I'm going to assess it. It's symmetrical. The borders are clear. The color is consistent throughout. The diameter is less than 6 millimeters. And evolution, has you noticed any change in this freckle?
No.
Okay. So that was the skin. Okay, so now I'm going to listen to your chest and feel around your chest, okay? So what I'm looking for is symmetry, feeling for any tenderness or crepitus. I don't feel any lifts. Good. Now I'm going to listen to her respiratory sounds. I want you to take a couple deep breaths, Megan. Lift up her arms a little bit. Okay, just relax. Okay, I didn't hear any rales, wheezing, no adventitious lung sounds. It's all clear to auscultation. Now I'm going to listen to your cardiac sounds with the bell of my stethoscope. We'll start here with the aortic. Pulmonic. Herb's point. Tricuspid. Good. And the mitral. Sorry. Okay, so I heard S1 and S2, regular rate of rhythm. I did not hear any S3 or S4, no gallops or murmurs. The apical pulse is located in the fifth intercostal, mid-clavicular, so about here. All right, so now I'm going to assess your coastal vertebral angle for tenderness. I'm going to tap back here twice. You tell me if you feel any discomfort.
Nope. Nope.
Okay, so no CVA tenderness. While I'm up here, I'm going to assess her pulses, carotid, +2, +2. Let me see your arms. We'll do the brachials. Symmetrical +2, radials. Symmetrical +2. The femorals are located here. I will not be assessing them. The popliteal is behind her knees. +2 and +2. Then we have the posterior tibialis. +2 and +2, and then her feet, we have the dorsalis pedis. +2 and +2. Okay, Megan, can you lay down? And I am going to assess her abdominal area. So right now I'm looking for contour, symmetry, looking for any trauma, any scars. And then I'm going to listen to her bowel sounds with the diaphragm on my stethoscope. I hear bowel sounds in all quadrants. Now while we're here, I'm going to assess for bruits in her arteries. We'll start with the aortic artery, renal, iliac, and the femoral, which is down here. I did not hear any bruits. Now I'm just going to feel around your abdomen. I'm going to press a little harder now. Alright, so I'm feeling for enlargement of the liver and of the spleen. Okay, it's all intact, not enlarged. So while I have her laying down here, I'm going to look at her legs. Can you extend your legs?
Mm-hmm.
Well, maybe we can put them on this table. Okay, so what I'm looking for here is any kind of edema or varicose veins. She does not have any. And I'm going to look at her feet. Okay, Megan, I'm going to move one of your toes towards me or towards the TV set. You tell me which way they're going.
Towards me. Towards the TV.
Okay, which foot am I touching?
Right.
Okay, great. Now if you could sit up. Okay. So right now, I want you to hold my hands, and I'm going to pull away, and then you're going to grasp them, okay?
Okay.
Okay, so we have equal bilateral wrist strength, 5 out of 5. Let's see. Okay, so now I want you to move your elbows, bend your elbows towards you. Pull them in, okay? Pull them out, push them out. Okay, extend your arms. Pull up to the ceiling. Press down towards the ground. I would say 5 out of 5 upper bilateral upper arm strength. Can you go, stay seated. Maybe you can sit here. Okay. So extend your knee. Extend your knee. Now flex your knee. Back to you.
Sorry.
Extend your knee. Flex your knee towards you. Okay. Bilateral +5 strength of the lower extremities. Can you stand up again? Okay. Kick your leg towards me. All right. And then keep it up and pull back. Okay. Let's test the strength of this leg towards me. Pull back. Okay. Very strong. 5 out of 5. Okay. You can have a seat there. Okay. Now we're going to test for the her deep tendon reflexes. We'll start with your bicep. Okay, just relax there. Okay, that was a +2. Let's try this one. Okay, that moved a bit too. +2. Now we'll do your tricep. So we're going to hang you over like this. Let's see here. Okay. Now this one, that was a +2. +2. Now the brachioradialis. +2. Okay, +2, symmetrical. Now we'll do the patella. Relax. +2. +2. And then we'll do the Achilles tendon. So relax there. +2. Okay. Thank you, Megan. So right now I'm going to ask Megan if she can walk towards the wall over there and walk back. Okay, what I'm assessing for is her gait. She demonstrates a balanced gait and equilibrium. Okay, the last test is the Romberg test. I want you to stand with your legs together. Okay, she's very well balanced. And now to finish off, go ahead and close your eyes. She's balanced. Take a deep breath in and exhale. Okay, thank you, Megan. And that is my assessment. Thank you.